if you imagine a double-decker bus, you you can imagine how the NHS workers are right at the top of the double-decker bus. They can see what's coming.
Mm.
They know what's coming towards to hit us.
Are you all my personal dreams?
Hello and welcome to Samosa Chats episode 20, the season finale. And we've got with us Dr. Meenal Viz. How are you today, Meenal?
Hi, Preet. Thank you for having me on the show, first of all. And how are you question is a very difficult question to ask to doctors working in the NHS right now. I think we've hit a point where we just don't know how we feel anymore. Our emotions are changing almost on a daily basis. But today is my day off, and I'm just using this time to wind down and relax and have a chat with you because I think I need that sort of I need that emotional reserve to go back on Monday morning.
Well, I'm glad I can help. Unfortunately, I think you know what the conversation is going to be dominated by.
Yeah.
But so let's get into your background first. So obviously you work with the NHS. What's your sort of medical background then?
Well, I studied medicine in Prague. I was there for 6 years. I graduated in 2018. And I came back to the UK. So just again, originally I'm from Gibraltar. So I've never lived in the UK before. I studied medicine in Prague. I graduated in 2018 and I came to UK. I started working as a senior house officer. My first job was in the oncology department, and I was there for some time, about 4 or 5 months. And then after that, I moved into acute medicine and emergency medicine. So that's currently where I am at the moment.
Right. Okay. That makes sense. So I guess the first question really to understand is what the hell is the coronavirus?
What the hell's going on?
Yeah. What is going on, Meenal? Please tell us.
Well, Preet, it's very. I mean, we're getting a lot of things on the media. We're getting a lot of things on WhatsApp. I'm sure your mom and your aunts are forwarding you things every day, and it's getting very frustrating now as well. Like, all the news that's going around. But basically, this virus we first heard about a few months ago in China. That's where it came about in Wuhan. The first time people heard about it, the first time doctors heard about it, they were trying to raise the issue with the Chinese government, but they were silenced because the government didn't want to sort of expose to the world that there's something going around. Now, the doctor, I must say, who was silenced, he was an ophthalmologist. And it's interesting because we weren't aware of this until a few days ago, but ENT doctors, ear, nose, throat doctors, are the ones at the highest risk of exposure to this virus. And I guess it's for obvious reasons, right? Because they're looking into people's noses and mouths and, the whole ENT system. So he was an ophthalmologist. He raised the concern that this virus is going around, but the government had silenced him. And it's really heartbreaking to say, but he had a wife who was expecting the second child. He caught the virus in a clinic because someone came into his clinic and she had the virus, and he ended up in ITU on a ventilator and he passed away. And this virus has gone from Wuhan to around the world. The interesting thing about this virus, Preet, is that it's not like the flu. And I think it's really important to emphasize to your listeners, to yourself as well, that this virus is not something that just affects your lung and that's it. This gives you a bilateral pneumonia. It affects both lungs. So both lungs means that you're going to struggle to breathe if it gets to that stage. And this is why I want to emphasize again, you're going to hear a lot on the media that there were old people, vulnerable people, immunocompromised people. But we've seen healthy young adults come into ED, come into A&E with this virus and have had to get the ventilator, have had to go on a ventilator machine because, as I said, it does affect both lungs and you do get a bilateral pneumonia picture from it. So this virus...
So what's a bilateral pneumonia picture?
So it will affect both lungs. Bilateral means both sides, so it's going to affect both lungs. Usually with the flu or with a common cold, you can get away with it at home. It doesn't affect your breathing as much. There are some really stupid things going around on WhatsApp that I'm sure you've come, or if you haven't come across it, I'm sure your mom's come across it. But it's something like,
Trust me, I've come across it.
yeah, I'm sure you've come across it. But people are saying things like it creates mucus secretions in your lungs and make it difficult to block. And it's you don't need. The thing is, that's not important information, right? You don't need to know that. You don't need to, as someone, as a citizen, as a member of the community, you don't need to know that. You just need to know that it's not as easy as tackling the common flu. And this is why people are dying, and this is why people are going into hospital. And I haven't come on your show today, Preet, to scare anybody, but I've come on to emphasize the impact this is having on people, on their lives, and on doctors as well. Because if you're not careful, you're going to spread it to us, and we still have to show up to work every day. Obviously, the government just yesterday announced that everything is shut down, which is great, and we're really happy about that, because I think these measures should have been taken before, because we had enough time to learn from other countries. But they decided to only take action now. And it's great that people don't need to go to work, people don't need to sort of socially interact, but we still have to deal with patients in our hospital. And
So on a ground level, sorry to interrupt, but on a ground level, what are you seeing with the virus in hospitals? Like, I guess that's a twofold question. I guess firstly, what are you seeing with the patients that come in with the virus?
yeah,
And secondly, what impact is that having on the hospitals?
I'll talk about the impact it's having on staff mainly, Preet, because what's
Yeah.
happening in ITU, what's happening in A&E is obviously important to understand. You obviously, everybody knows that we are short staffed, we're under equipped. We know all of that. That's coming in the news. But I think I want to talk about what the impact is having on my doctors, my colleagues, my nurses, healthcare assistants, even domestic staff, people even working in the ambulance. There is panic and fear spreading through all of us. And you can feel it when you go and speak to someone, when you ask for advice from a senior member or from anybody else. We all have a very short fuse now. Like, there's just like no time or no space for any sort of bullshit or anything like that. It's just get to the point and that's it. Like, don't mess with me, don't mess around, because people are scared that they might catch the virus. People are scared that they might take it home to their child or to the elderly parents. We just don't know what's happening, and we don't know if we've had it. We don't know if we're carrying it. We don't know if we're positive because there are not enough tests going around. So on that level, in terms of working in the hospital right now, it's scary. We are running. Our goodwill is running on fumes now. Our kindness is running on fumes, and this is just the beginning of it. And I worry what's going to happen in the next week or so, because it could just get worse.
Yeah. So when it comes to like your own workplace, and I guess obviously the sort of the sort of feeling of tension and panic in the air and stuff, how can normal people like myself, how can we sort of assist with that?
That's a really good question, Preet. And before I answer that, I just also want to say that people who are listening in, I have had very supportive. I've had a lot of support from my seniors. Everyone has been very understanding so far of my concerns and my worries. No one has shut me down. No one has told me to sort of shy away from asking. I've been very clear with my worries and concerns, and everything that I've raised has been tackled. And I also want to emphasize again that the problems that are happening are not based on my hospital or my husband's hospital or any hospital. It's all based from a government level, funding, tests, all of these things are coming from there. So our qualms are not with our hospitals. And I'll say this again on the record. I've had a lot of support from my colleagues. Everyone has been very caring and very understanding. It's the panic that's going through around people is just inevitable. It was going to happen and it will happen. But so many doctors and nurses are stepping up and taking that lead to be kind and to still be compassionate. And I think that's really the most important thing that people need to know. So going back to your question, Preet, I just wanted to clear that so that people understand that we don't have qualms with the hospitals or our senior members, because everyone's been really supportive. How can the public help us? Well, you've seen on the media, you've seen on even on social media, I'm sure that everyone's telling you to stay off the street so you can help doctors. And I think that's the main message, Preet. Respect our medical advice. Respect the fact that we know what we're talking about. We're on a double-decker bus right now. We're at the top and we can see what's coming our way. The public are in the same bus, but they're sitting right at the back. They don't actually see what's coming. They don't know what's coming around, and I don't expect them to because they're not at the front line of what's happening. We have seen what's happened in Italy, what's happened in Spain, and as I mentioned to you before we started recording, I'm concerned about even my family in India because they haven't been hit yet, and they haven't been hit yet because they haven't had enough tests to test all the people. So again, numbers don't mean anything at the moment. It means nothing to us, even in the UK, because not everyone is being tested. So I would just ask the public to please keep in mind that you are putting people at risk who are elderly. You're putting people at risk who are immunosuppressed. You're putting people at risk who work in the hospital who have to go home to their family as well. Boris Johnson did say that if you have a fever, if you have a cough, to stay at home. Yes, you should stay at home if you have a temperature and you're unwell. But if you are worried about your condition, if you feel that you're deteriorating and you need medical input, call 111. Don't sit at home in fear. Because I think that's another concern that I have, is that what if you're sitting at home and you're really unwell and you might deteriorate quickly? People are being very kind and saying we don't want to burden the NHS staff. Yes, we are under a big burden now under this pandemic, but we are here to serve you. That's our job. And we're never going to forget that. That's what we're born to do. It's in our blood. We want to show up to work every day and help you. We can only do that, though, if everyone's on the same page.
Just previously, you just mentioned that this isn't a hospital-wide issue. It's not a team issue. It's a government issue. What did you mean by that?
Well, what I mean by that, Preet, is that as doctors working in the hospital, my consultants and their managers and whoever's involved in leading this pandemic, they're not directly involved in ordering masks. They're not directly involved in funding for the equipment, right? It's coming from a higher level, and they're following their orders. And this is something that as doctors as well, we need to understand that everyone is stuck in their position and everyone is trying to follow everything that they're receiving from above. I'm following my consultants are following their managers, and it just goes up and up. So I think we just need to remember that. And I also want to emphasize again, I've had a lot of great support from my colleagues. I'm happy to go to work because I have that support. The fear is, why has the government only acted now and not weeks ago? So your question as well about how can the public help us? The public can help us in all the ways you're seeing on social media already. I don't want to repeat myself because I'm sure you've had enough WhatsApp forwards and
So I'm seeing a lot on social media and stuff about how the government's actually getting quite a bit of praise for what it's doing now. And I've always kind of, like, reading through it, it's always kind of seemed to me that they're basically getting a pat on the back for minimize or trying to minimize, having a jolly good effort at minimizing a situation that they've in fact increased. What should the government have done before?
Everything they're doing now should have been done 2 weeks ago, Preet, or even 7 days ago. Yes. The ordering of masks, the ordering of PPE, which is personal protective equipment, which essentially is just a surgical mask, an apron, and gloves. All of these things should have been done weeks ago in preparation for what was coming. The government are getting all these pats on the back to say, okay, well done, you're doing a great job for handling it. And it's great to see Rishi Sunak say we're going to help people who are worried about their jobs and their wages, and all that is great. Boris Johnson has shut down schools and he's kept them open for children who still need to go in because their parents are working in healthcare or in the supermarket, and they're providing service to the public. And it's great. Honestly, I'm glad that he did that yesterday, and I'm glad that this is the decision that was made. I just wish it was done before, and if they had done it a week ago or 2 weeks ago, it probably would have helped us a lot in the NHS right now.
So is that just through the sheer volumes of cases that you're getting?
It's not just the sheer cases of volumes of cases that we're getting now, because I'm sure it will go up in the next few days, in the next few weeks. But it's the uncertainty. It's the fear that, well, if we didn't have enough masks today, then we just don't know what's going to happen tomorrow. We may run out of something else. We may not have enough ITU beds. You see what I mean? Like there's a long list of things that we might not have, because if they weren't ready for the basics at the start, we're just worried about what's going to happen later on.
Yeah, that kind of makes sense. Yeah, because obviously I think everybody's expecting the cases to now be going up. I've been seeing a lot of stuff again, as you can tell. I get a lot of my news and stuff, a lot of my real world news from social media, I guess. And I'm seeing a lot of people that are still going out into gatherings and stuff, pubs. Like last night, it was almost like a nationwide thing where people were going out to pubs for one last drink before they close. What are the dangers of people doing that?
The thing is, Preet, I don't know how to emphasize this more than you can put enough social media posts out, and you can put enough tweets and Facebook posts, Instagram, put it on the news. People still might not listen. And the only thing I will say, Preet, is that as NHS workers, as people working at the front line, I haven't been into the emergency department over the last few days. My husband has. If you imagine a double-decker bus, you can imagine how the NHS workers are right at the top of the double-decker bus. They can see what's coming. They know what's coming to hit us. The public are sitting at the back, on the bottom floor, right at the back, and not able to see what's going on, not really knowing what's behind, what's in front, what's left and right. And I think that's what people need to understand. You going out means that not only are you putting yourselves at risk, it means that you could put someone at risk who may have to come into hospital. They will come into hospital, we get affected. A lot of doctors currently working may even be pregnant. They may have to go home to their pregnant wives. They may have to go home to their elderly grandparents. What about them? Why are you not thinking about them? Is one pint on a Friday night going to kill you? It's not. You can stay at home, and we are not telling you to isolate yourself in a wartime zone. You've got TV, you've got your computer, you've got your phone, you've got things around you. I understand it's not easy. It is a very difficult time, especially for those who have anxiety, you've got mental health issues, who may not even enjoy being at home. I get it. But going out to the pub is purely selfish, because you're not thinking about other people around you. And my plea is to please stay at home. Don't take this lightly. Even in the supermarket today, I went into Tesco, and I mentioned to you this morning, it's like I was desperate to get fresh fruit and veg, because I don't even remember the last time I ate a banana, because nothing is around. People are still not practicing social distancing in the supermarkets.
Yeah.
Even then, you're allowed to go out. I'm not saying stay at home for 24 hours and you're going to get cabin fever. I get it. But even when you're out, please be mindful. Please keep that distance. Please keep sanitizing your hands. Cough into your elbow. These are all very basic things, and we all have a moral responsibility to care for other people around us, because we are a global community right now. We are not London going through a pandemic. We're not, UK going through it. We're not Italy. It's a global thing.
Yeah.
We are a global community, and that's how we need to see it.
Yeah, I'm seeing a lot of people. I think what you just mentioned there as well. It's not even just about yourself, i.e., being, this person who can get over colds and flus and stuff. Being a young person where it's not going to be quite severe. It is about the wider community. It's about infecting that person that you walk past in a supermarket who's 80 or whatever. And I see that a lot in some of these videos about, like, there was a lot of interviews with people in pubs and stuff, and they were just kind of sort of brushing it off and be like, well, I'm young and it's not going to really affect me. And it's kind of like, is boredom really worth risking someone's life? Maybe not your own, but someone's life.
Yeah. Well, Preet, you're just talking about the supermarkets as well, and I'm sure you'll ask me this question about panic buying, but I'll answer it before you ask
Yeah.
me. um, I was in the supermarket today, and there was all this most of the shelves were empty for like eggs and bread and everything, which is fine. I was like, well, we'll figure something else out. We'll just have to change our menu up a little bit. It's fine. There's still food, and I'm very grateful for that. Even if I have to eat cereal 3 times a day, it's fine.
Yeah.
Like it's okay. But there's some people I saw with like 10 loaves of bread in their basket. And like I understand some people live in big families, Preet, but I mean, do you really need 10 loaves of bread? And then you know just half a meter behind them, you see an elderly couple just trying to find food. And they're obviously struggling because usually they would have people helping them and stuff because of now the social distancing thing that's happening. They're trying to sort of fend for themselves as well, and it's heartbreaking to see. And I'm talking about it now, Breathe, and I just want to cry. Like it's the only emotion I can think of right now to just let it out of my system because yesterday I discharged a couple of elderly patients and they asked me, they said, is it true that there's no loo roll, there's no toilet roll? I don't have any food at home when I go home. It's Friday night yesterday, 8 p.m.
Yeah.
I was sending these patients home and they were concerned. They was like, well, I can't go to the supermarket till tomorrow. And I had to sit down with them and explain, like, if you go tomorrow morning and there's no bread, that's fine. You can try go in the evening. They're restocking. That should be okay. But I don't know if I can say that in 5 days. I just don't know what's going to happen in the next few days. I don't know if
Yeah.
we'll have that capacity to do that. And this is going back to what I was saying earlier, that don't just think about yourself, think about other people as well. This is the one time we're asking you to stand up and have that moral responsibility for your community. And this is the one time that you really need to think about it.
Yeah. It is quite an interesting thing. Like in my lifetime, this is the first time I think anybody's ever gone through that. And I think a lot of these like uber patriotic people, Brexit means Brexit kind of thing. Now's their time to like start showing how patriotic they are by sitting at home and doing fuck all. Like,
Well, yes. Yesterday, the Weatherspoons owner, who's known to be a Brexit supporter and supporting Boris Johnson, he said he wouldn't shut his pubs, and this came out at about 2 p.m. So this was before the Prime Minister's message at 4 o'clock when he shut everything down. But you just see people just refuse to understand the severity of it, and it's also what's happening in with India right now. I mentioned this before you called me. In India right now, yesterday I saw a Bollywood actor go on screen and say, "Oh, like everyone isolate yourself, stay at home, protect the vulnerable, whatever." And that's fine. I'm glad people are raising the issue and that needs to be done. But it's easy as a Bollywood actor to isolate yourself in a 10-bedroom house. You can do that, it's easy to do that. But what about the labor class? How are they going to survive this? They don't understand the severity of the virus. And if they have a fever or cough, even on a normal basis, they will still show up to work because they have to. Who's going to protect them? We have our government here who are doing everything they can to protect us because we are a developed country. But what about them? What about those people who don't have that protection? And in a pandemic or in any political situation that comes about in the world, it's always the same people that gets affected. And that really breaks my heart. It's always going to be the labor class in India, the lower class in India. NHS workers are affected again due to what's been happening. It's always the same people affected. And this is the time now for everyone to stand up and make sure that doesn't happen. That the people who need to be protected are protected, because the government's not going to protect us. They will try to and they will do their best, but ultimately, as a society, this is where we need to hold well, not hold hands because we can't do that right now, but you know what I mean. Metaphorically hold hands and stand together.
Yeah, I am with you there. I think you raised a couple of interesting points where, I think over the past, like even myself, over the past week, I've been like, oh my God, can't go out, can't do this, I'm so bored. But then like you think about an actual underclass, like say in India, where they do have it bad. They don't have the level of education that we've been fortunate enough through our governments and stuff know a lot about, social distancing. This is what this thing is. This is how deadly it is. And we have the luxury of employment laws as well. So even though people are suffering here, self-employed people, freelancers, that kind of stuff, I mean, it can always be worse. Imagine having to still show up to work. And if you don't, that's it, you're just done.
Yeah, and the thing is, Preet, this is not just coronavirus times, this is their life in general.
Yeah.
If they're unwell, they still have to show up, and society in India won't function without the labor class. They need them to run their businesses, they need them to run their offices. And I had a very stern conversation with my family members in India today, just sort of warning them that it's going to hit India just like it's hit us here. And they're like, oh, it's fine, we'll keep sanitizing our hands, we'll keep washing our hands. And it was like screaming into a black hole.
Yeah.
They're just not ready. And India, it seems like a lot of people have pride that Europe wasn't prepared, but look at the numbers in Europe, look at the numbers in India. Well, if you're not testing everyone, then obviously the numbers are going to be low.
Yeah, I had this conversation with somebody at work as well. About how India probably has been hit very hard. It's just that it's unknown.
Yeah. Yeah, and people are this is the thing, Preet. I feel like people at this time are choosing. They've made the choice to be ignorant. They've made the choice to say, well, it's happened like this in other countries, it won't happen to us. And these are educated people, Preet. These are people who've seen the world, who've traveled, and I've spoken to these people myself. And I'm not generalizing. If it comes across like that, I do apologize. I'm not generalizing. I'm sure a lot of people in India are also on the other end where they're trying to protect themselves, their families, and those around them. And I'm really grateful for people like that. But I'm talking about my own experience right now, where I've spoken to some family members, I've spoken to some people, and it's that ignorance that they feel, and it's always been like that in India, because as a middle class, a higher class, they've always had some sort of protection, whether it's financial or government protection, and they feel like they're going to have it as well with this virus.
But that's not the case.
It's not the case. It's a completely different time.
Yeah, 100%. You mentioned, just bringing it back to the UK, you mentioned nurses, and I guess the NHS as a whole are the people on the top of the double-decker bus.
Yeah.
If you were to explain it, pretend I'm an idiot. Let's pretend. Let's make that giant leap.
I don't need to pretend. I'm just kidding.
Let's make that giant leap and think I'm an idiot, right? What's coming our way?
Preet,
that question.
You've put me in a difficult.
That question's so dumb that you're speechless.
No. I'm not speechless because it's so dumb. I'm speechless because I don't know what to say. I'll put it this way, Preet, and I'll let your listeners conclude what my message is, because I don't want to scare people. I don't want to create any panic amongst the samosa community. But what I will say is that please remember, not everyone has been tested. Please remember, healthcare workers have likely been exposed to this for a while now, and we haven't had our protective gear, which has been on the news. Please remember, all healthcare workers have not been given the opportunity to be tested. Even patients who are sat at home with a fever and cough, we don't know if they have it because they haven't been tested. Because at some point, the NHS at some point had said we're not going to test people in the community. This was last week, Thursday. But they said they are going to bring it back out again, and they are going to test people in the community. I'll let you do the math. And I'm going to leave it at that because as a medical professional, it's my job to inform you. It's also to protect you. It's also to make you understand that we are here for you. We're going to do everything we can to make sure our public is safe. But please don't listen to the media or don't look at the numbers. If we're all educated, we all have a good head on our shoulders. And just try and use that to gauge where we are right now.
Yeah. Because I guess there's a difference between, and I guess I'm not a medical professional, so I guess I can scare people. It is one of those things.
No, you can do that.
I guess it is just one of those things. And I've thought this from the beginning, which is that these are just the confirmed cases. If they're telling people don't come into A&E, don't go into hospitals to get the test, the real figure is probably way, way, way higher than what they're reporting. And I guess it is a case of trying not to panic people. Just a quick question. I don't want to get you into any political conversations or anything here, but have the historic cuts that we've been experiencing for the last 5 or 10 years, have they had a big impact on the actual way that this has been handled and the effect it's had on the NHS and hospitals?
Do you mean the funding cuts? It definitely has, Preet. And I won't go into, as you said, I won't go into the politics of it. I won't go into the nitty-gritty of it. But the main message I want to put out here is that the cuts that have happened in the NHS, it's affected, obviously, the hospitals and the way hospitals run. It's affected our salary, it's affected our wage as doctors, and it's affected our training as well. The UK is desperate to get juniors. We need a lot of juniors on the ground to allow hospitals to function. And to do that, they've sort of prolonged our training program, so our time as a junior doctor is longer. And I want to just say that as doctors, we face issues that affect us, and then 6 months later it's a new thing, and then 6 months later it's another thing. There's always something that's affecting us working in the hospital. And we talk about morale, we talk about goodwill, but every time something like this happens, whether it's a financial cut, whether it's the junior doctor strike we had a couple of years ago, whether it's the pandemic now, how long do you think we can keep going for?
Yeah.
How long do you expect us to keep showing up to the hospital and putting our stethoscope on and saying, right, let's go save lives? Because it's hitting a point now, Preet, where I'm going to work, I'm doing my job only because I know that this is a difficult time for the NHS, and I feel like I have a responsibility to help, and I'm more than happy to do that. After this is over, they will tell us, oh, we'll help you, we'll sort everything out for you. We don't even have a coffee room for ourselves, Preet. We don't even have an office where we can put our coats up. I go into hospital, my coat's on the floor. I go into hospital and I leave my handbag with my valuables. I don't even have a locker.
That's crazy.
Because they say, oh, when you put your stuff inside, just make sure it's to your own discretion. Like, something might happen, we're just letting you know. I'm not asking for the government to pay us money. I'm not asking the government to give us 80k salary as a junior doctor. When all of this is over, please consider, and this is to the government, if they could please consider giving us a coffee room.
Yeah.
Giving us a room where we can sit and relax, where we can close our eyes after a 13-hour shift before we do our 30-mile journey home. We don't have any of that. And I'm so grateful for what's been happening in the last few days, where they're giving out free drinks, and I've seen some taxi drivers waive their fee in London as well. And that's amazing. I just hope that doesn't die out. That's my worry, because people now are seeing us working to the ends to make sure that everyone is safe. But Preet, we do this every day.
Yeah.
We see suffering on a daily basis. We see people dying on a daily basis. We give all our energy into work and come home with nothing to give to our parents because we're exhausted. We don't have that emotional energy.
Yeah.
But we're willing to do that. We're going to carry on and we're going to keep fighting. But just please consider, next time you go into a hospital, next time you want to donate to a charity, just remember us as well. Because we don't have any of that. We don't have the luxury of just sitting in a coffee room and putting our feet up. And this is what the public needs to be aware of, and this is what the government needs to be aware of.
Yeah. I think that's something that I kind of have, like, whenever I hear, especially during Boris Johnson's, like, little daily updates and stuff, that's something that always kind of goes through my head, which is like, it's not just now that doctors and nurses are expected to work 12, 13, 14-hour shifts.
Yeah.
For a long time, especially over the last few years or whatever, it has become the norm. Like, that's just the job description, isn't it?
Well, Preet, I'll give you a good example, right? Yesterday, Rishi Sunak said that he would cover the salary for employees, and he said up to 80%, I think, up to about
I
2,500.
think it
Did
was
he
two
say that?
grand.
2 grand, yeah. Preet, an F1 junior doctor earns just about
Mm,
that. So if you imagine people who are not working in the health industry, people who are working from home, and they will they will be able to get all of this money back. But we still have to show up to work during this pandemic. We still have to, because we're earning our money in that way. And people need to understand that as a junior doctor, as an F1, F2, which is Foundation Year 1 doctor, which is the first job you get coming right out of medical school, you don't earn enough to even save money to buy a house. You don't earn enough money to even save on a monthly basis. That's the reality on a
yeah.
normal day. That's the reality for us on a normal day. A few days ago, I was speaking to a journalist, and I just asked her. I said, "How much do you think an F1 earns?" She said, "Yeah, they probably earn about 60K," and I just burst out laughing. I was like, "It takes years as a doctor to get to
Yeah.
that stage. It takes years." So we are not even we bear the brunt of the finances. We still show up to work. We still work nights. We still do 12, 13-hour shifts throughout the night. We still show up the next
Yeah.
day, but it's still not enough, and we still have to work extra hours just so we can get some savings and go on a holiday just to get away from our work and come back more energized.
Yeah.
So all that you're seeing now from the NHS, people working hard, people going in and out, salaries, everything, this is normal. This is us on a daily
Yeah.
basis.
Honestly, I think on behalf of like our listeners, and I guess just people and decent people in general, I think it's just a massive thanks, isn't it? Um,
Yeah, and Preet, I think the love that's coming in is so overwhelming. The admiration for the NHS workers is really admirable, and I think we can't forget those working in supermarkets, those working in petrol stations. They're also risking themselves by going out. So it's a big thank you to everybody who's put themselves out there on the
yeah.
line.
Well, thanks for coming on, and secondly, thanks for doing what you do like every day. Um, it's I guess we need to end on a positive note because I'm feeling sad as shit right now, Meenal. like,
I'm sorry, Preet. I think this is the first time I've spoken this way, and I think this is the first time I've I felt I'm not saying it's the first time I felt passionate as a doctor. I've always felt passionate as a doctor, but I think this is the first time I'm just so passionate about making sure that we're all
mm,
protected. You and the community and us as doctors. My heart is
yeah,
aching, Preet. Not just for us, but for our families in India, for the poor people in India, not just in India and Africa, everywhere around the world, those who will be affected, and it's always the same people who get affected, as I said earlier. My heart is aching. I haven't slept for like a week because I just don't know what's going to happen. And I'm sure a lot of people are going through the same thing, whether they work in the NHS or not. But it is a difficult time. It's a very difficult time. But we will get through it. We will get through it as long as we
I
work
think
together.
I think it's important for. I know you've said that this is the first time you've spoken like this, but I think it's important for people in your position, so NHS workers and stuff, to actually come forward. And I know this does happen not categorically, from time to time, where there'll be one news article about the conditions in the NHS and stuff. But I think it's important because you guys have the spotlight now, and I think it's important for you to actually show
Mm,
the human impact that's having, like what you said at the
mm,
start, that you're in this constant state of worry and tension that you could be passing it on to your children, your parents, that kind of stuff. But then also
mm,
the absolute ridiculous hours you have to work even before this, and like the type of jobs that you're doing, it's emotionally
mm,
taxing, conveying hard messages to people and to their families and that sort of stuff. I think it's important that
mm,
my only hope is that throughout this whole thing that people realize how much we rely on the NHS, and what it means if it doesn't work the way it's supposed to work.
mm. I think people have shown. I think all doctors are working in solidarity now. We're all working together. We're all supporting each other, and people have shown a lot of respect and a lot of gratitude. And that's all we
Yeah.
need. That's all we need to keep us going. And as I said, our goodwill is running on fumes. But we can get that back. We can get that fire back as long as we're kind and we're respectful to each other. Yesterday, I had a patient who I had to send home, and they got really angry because they were waiting for medication, and they just went off on one, and they started shouting at the nurse, and the nurse was really calm and said, "Can I offer you a cup of tea?" And I was just in awe. I was like, wow. Like, you don't know what's happening in the hospital right now. You don't know if you're sending anything home to your kids when you go back. But you still have that inside you to say, look, I know you're angry. You're angry at something that's not my fault, but I'll still make you a cup of tea. And these are the kind of people who are working for you right now. These are the people who are putting their lives at risk for you. Just try and help them where you can. Stay at home. Be safe, and that's all we're
It's a
asking.
good little summary there. Essentially, it's be nice and don't be a dick and endanger other people.
You can put it that way too.
I don't have that
Yeah.
representing the NHS stuff. I could just tell people, just don't be a dick, man.
Yeah.
Please. What projects do you have coming outside of work? I know you're a busy woman, obviously, but I think we'll end on a positive note.
Yeah. Well, Preet, I think that I've made it quite clear over the last half an hour or so that my passion lies within helping the community, and not just working as a doctor, but working globally as well. We're a global community, and we can all help each other. I became a doctor because I wanted to help and serve the community, and I do that in hospital on a day-to-day basis, but I feel like there are other ways to do that as well. And podcasting is one of my passions as well. So if you can put the link in your description, but my podcast, Meenal's World, is all about empowering us South Asians to believe in ourselves and to follow our passions. And I try to interview, celebrities or people who've sort of been through that journey of success, because nowadays we live in a society where we want everything so easily on our fingertips. We want Netflix, Amazon, order stuff, it comes the next day and it's done. But people need to see the true side of success and hard work. So that's one of my passions, and I like to help people through that. So I enjoy podcasting. I have a podcast that comes out every Friday. This week, obviously, it's been a bit delayed for, obvious reasons.
Jeez, why was that?
I've been too busy on that double-decker bus, Preet. Another thing that I started a few years ago was we have a charity my husband and I have founded, and it's based in Kenya, and we care for 12 orphans there in Kenya, and we fund their food and education, and we try to empower them through that. And our dream is to build them a home, an orphanage where they can be safe. Right now, all our kids are isolated at home because I gave them the warning 2 weeks ago. I said, don't even bother going to school, just stay at home. But our issue now is that we need some funds to help them with their food, just basic bread, rice, because we're running out of stock. So if anyone out there is happy to help us, please just get in touch.
Please.
I'll give you the link.
We'll definitely put that in the
people can get in
descriptions
touch
and
with me through
everything,
that.
and all over the social media.
Yeah.
Thank you again for coming on and getting in touch. And I generally do hope people take it on board, take the advice on board, and sort of think about the human impact that's been going on in people like yourselves' lives. I think that's important. Let's share a happy thought before we go. You're like, I've got nothing.
I've literally. Well, Preet, you've asked me such difficult questions in the last half hour. I mean, my mind is I need to switch my mind up. But a happy thought is, Preet, I will say this. My heart is filled with gratitude with everybody who's helping, not just doctors, but even the elderly. Yesterday, I saw an elderly couple shopping in Morrison's, and someone offered their help to hold their bags and baskets because they realized that they were trying to bulk buy. And that really made me smile, breathe. And I just want people to understand that amidst all this panic and chaos and virus, there are a lot of good people out there, a lot of good people doing a lot of good things. And I'm sure a lot of your listeners are those people. So let's not forget that, and just remind yourself from time to time that the world is full of a lot of good people. And if you have anyone around you who you feel is doing a good job, just remind them, just let them know that you're grateful for them.
A little bit of kindness goes a long way. Mine's not quite as sophisticated as
especially
yours.
Now.
Mine's. Did you hear about that terrorism attack in Barcelona? These two extremists drove into a mall, but obviously everything's on fucking lockdown, isn't it? So,
oh, but when did this happen? When did this happen?
I read it earlier this morning. So obviously the idiots didn't carry out their terrorist attack, just got arrested. I'm a big fan of they turn up in heaven thinking they've got 52 virgins, and they're like, yeah.
Oh my god,
you fucked up.
Okay, I mean, planning a terrorist attack when everyone's in isolation. I mean,
this world is just glitching hard. Like,
yeah, I mean, everyone's actually going crazy now.
Sensational. Well, thank you again for coming on. Oh.
Thank you, Preet. That's the first time I've laughed in about 24 hours. So
excellent.
Thank you for
no
that.
worries. I did my job. Thank you again for coming on. It means a lot. Dr. Meenal Viz from Meenal's World. Thank you very much.